My name is Maria Campos. I'm a fourth-year student at UC Santa Cruz and a native of Los Angeles County. I come from a family of 5, my twin and I being the youngest ones. My parents, whose names are Yolanda and Santiago, immigrated here in 1970, so 39 years ago. Both my parents became U.S. citizens in 2008.
All right.
My father worked all his life in companies that really made all workers sweat. My dad worked with his last company for 8 years. In these 8 years, my dad was never given health insurance or no sort of benefit. It was really upsetting to me to see my dad get home tired, dirty, and not in the mood of doing much every single day. My dad was diagnosed with cancer on January 14, 2009. This day was one of the worst days my family and I ever experienced. I asked myself, why my dad? I'm only 21, why did this happen to him? He was a father that cared and would do anything for his family. He never missed work just to miss. Even if he had a cold, he was still at work. My father was a gran trabajador, a great worker. 2 weeks after he was diagnosed, we went to the hospital and the doctor said we had not much to worry about. He had stage 1 cancer and everything would be okay. That didn't make us feel great, but I think it made us feel okay. Throughout this whole time, my dad never stopped working. He was scared of getting laid off, so he preferred to miss his appointments because of that reason, and because he was afraid of getting high bill amounts. By mid-February, my father had no other choice than to stop working. He began his radiation treatment, and his treatment completely drained his energy out. I can't say this was one of the hardest things we saw. During these first 3 weeks of his treatment, we saw my father's appetite go away. He had so much fear of leaving us, and all he wanted to do was be alone and sleep. Unfortunately, my father passed March 9, 2009. 3 weeks into his treatment, my father ran into a lot of complications that doctors never gave us explanations to. These whole 3 months since my father was diagnosed to the day of his passing was the worst. I feel everything happened so fast, and what upsets me the most is 2 things. One is that I no longer have a father here to see me graduate in June, and two is that I feel my father would have still been here with us if he would have been provided some sort of health care insurance from his job. Every day people are passing away, and a lot of it has to do because of health care insurance. People don't go to the doctors because of fear of high bill amounts. Not having health insurance affects every single family in every possible way. Everyone should be provided with health care insurance. We need an eco insurance plan so that people can be safe from dying. Health insurance is something we all need and we must fight for. Thank you so much, and let's keep on fighting so our loved ones can be safe by attending a doctor's office without fearing of high bill amounts.